Hey everyone, welcome back to our educational series where we dive into understanding iron deficiency and its impacts, specifically explaining our blood test results. Thank you so much for all the positive feedback and questions related to our previous video. Due to the high nature of our feedback, we decided to break up this next video into two smaller segments. So today in this quick video, we're going to take it a step further and try and link iron studies with hematology by discussing the relationship between haemoglobin and ferritin. These two markers are crucial in understanding your body's iron status and overall hematology. However, they're sometimes misunderstood or misinterpreted. So we hope this video assists with further interpreting your blood test results. In our previous video, we discussed ferritin. And as a quick recap, ferritin is a protein that stores iron in the body. It's essential because it provides a reserve of iron that can be used when your body needs it. Low ferritin levels are often the first indicator of iron deficiency, and this is what we discussed last video. Why you wouldn't see serum iron necessarily discussed by doctors as much as ferritin is because you see the storage in something decrease before you see anything else. Now let's talk about haemoglobin. Haemoglobin is a protein found in red blood cells, and its primary function is to carry oxygen around the body. Low haemoglobin levels can lead to a condition known as anemia, which manifests through symptoms like fatigue, weakness, and shortness of breath. It's important to note that these symptoms can also manifest in cases of iron deficiency. So how do ferritin and haemoglobin link in with each other? So let's look at haemoglobin first. The main component of haemoglobin, or the reason haemoglobin is able to bind oxygen and carry it around the body, is because it is contained, or it has iron within it. Now, when your body doesn't have enough iron, it will deplete and deplete and deplete, and you may feel symptoms along the way, and a lot of people do. However, they go unrecognized or normalized and untreated. But if your ferritin decreases to a point, and we break this up into the different stages of iron deficiency, then it can get to the point where we don't have enough iron to make haemoglobin, or our ability to make haemoglobin is compromised. So in the early stages of iron deficiency, we see ferritin levels drop. However, haemoglobin levels still will be within a normal range. And this is because we lose our stores and we still have iron to make haemoglobin. And this is why ferritin is a more sensitive marker for detecting iron deficiency early on. As I said, if this goes untreated and the iron deficiency progresses, then we get to stage 2, which is commonly termed iron deficient erythropoiesis. And this is when haemoglobin production can be compromised. If this goes untreated, and it commonly does, then haemoglobin levels will fall, and this is what we call stage 3, or iron deficiency anemia. And this is indicative of a blood test result that will have a decreased ferritin as well as a decreased haemoglobin concentration. It's important to note several things around this relationship, or around this blood test result. Firstly, symptoms of fatigue, lethargy, and tiredness can occur at any stage of iron deficiency or anemia. Where there is common misconceptions around this is someone having a low ferritin and a high haemoglobin, or vice versa, a high haemoglobin and a low ferritin. Now, both are perfectly plausible and are seen very often. However, they could be due to several different things. And this is why a blood test is just an indicator for a potential underlying condition. So these are just biomarkers. They don't necessarily confirm something. So let's go through low ferritin. Let's go through each example. So low ferritin and a high haemoglobin. This is what we were just discussing. Essentially, it is common in iron depletion without significant impact on hemoglobin just yet. So you would see it in the early stages of iron deficiency. where the body's iron stores, i.e. ferritin, are depleting, but there's still enough iron to maintain hemoglobin production. Over time, if iron deficiency continues, hemoglobin levels will drop, leading to anemia. And iron deficiency is the commonest cause of anemia. What about situations where you see a high ferritin and a low hemoglobin? This scenario can be seen in conditions such as anemia of chronic disease or inflammation. In chronic diseases or inflammatory conditions, the body's response involves producing more ferritin, i.e. storage, as a way to sequester iron or keep it away from pathogens to manage inflammation. However, despite having high ferritin levels, the iron is not readily available for red blood cell production, which means we're not moving it around the body effectively, which is why things like transferrin and transferrin saturation are other important biomarkers to consider, because that will give you a better picture or a greater understanding of the physiological processes or potential physiological processes that are being impacted in the body. It's also important to remember that iron deficiency isn't the only cause of anemia. So you can see normal ferritin and low hemoglobin, for example, vitamin B12 deficiency. This is why blood tests that measure a variety of different markers, such as a full blood count and iron studies, are essential to get the whole picture as to what's going on. What are the underlying physiological issues with the body at this time? In summary, these conditions are complex and require a multifaceted approach to diagnose and manage. Understanding the underlying mechanisms and understanding how to interpret a blood test result helps in tailoring appropriate treatments and improving patient outcomes. I hope this video was helpful. Please leave any questions you have in the comments and let us know about other topics you'd like us to cover. Please also watch out for our next video, where we'll go through the rest of the full blood count and discuss these markers in terms of iron status, iron deficiency, and potentially iron deficiency anemia.